What are some of the key factors involved in Galilea's approach that you're bringing to the front lines of healthcare with your partners?
Yeah, and you called it out, like in our healthcare system right now, we have different specialists, and it pretty much is every specialist kind of working within their silo of care. There isn't a lot of collaboration, though we've seen that this integrative group care model is becoming more popular and people are definitely asking for it. So it's a really interesting time where I think women are asking for better care. They're asking harder questions. They want teams and not just a specialist here, a specialist there, and having to kind of navigate and be the liaison between those healthcare providers. And the other thing that I think is difficult is that when you're a specialist, you're really focused on your specialty. And it's difficult at times to go outside of that scope of practice to receive knowledge about emerging therapies like psychedelics. So GALILEA is really positioning itself to be that conduit and that liaison. If we can bring the information, the reliable education sources, and the people directly to those providers so that they have the tools and the resources to have conversations with their patients, and not shut those conversations down, which is what happens a lot at this moment in time. Physicians don't want to, speak out of turn. They don't want to break laws. They don't want to compromise their license. But I think there are certainly ways to have the conversation, to point to education, and even make referrals within the legal accessible system that we have. Because as much as we get really excited about the plant medicines that are coming down the pipeline, we have an incredible, powerful legal medicine that we can work with. And in order to make those referrals, you have to have very trusting relationships with the providers who offer it. So first and foremost, we want to be that liaison. We want to be that guide. I love, bringing other providers in psychedelic medicine into our fold, but I think our mission is beyond that, going outside of the bubble and speaking to the providers who, aren't in the choir just yet. So that's a big piece of it. Everybody involved at this point in our core group is in clinical practice and has had a lot of experience with plant medicine, caring for women, as well as working with psychedelic medicines. And so a big piece of what we're going to be doing is developing tools for practitioners to offer their patients, whether that is a more robust intake form that has women's focused questions, whether it's understanding how to offer care that is psychedelic aware and life stage aware, because that's how we should be offering care to women. And that's not just for psychedelics, but there's certainly an opportunity for psychedelics here.